Tell us about your interesting social science project and your favorite social science theory.
So communities of practice are a group of people with a common work objective and a common goal who meet regularly to problem solve, to support each other, and to innovate solutions in order to reach their goal. Communities of practice may be particularly relevant to lay health workers who don't necessarily receive formalized health professional education, but rather receive more on-the-job training and really learn from more experienced lay health workers. I will be studying the impact of communities of practice, including lay health workers, and how that could be facilitating their delivery of home-based TB care in Uganda.
So a theory that I use in my work in TB stigma was posed by Graham Scambler in the 1990s. He was a sociologist based at University College London, and he borrowed on ideas from Susan Sontag and Goffman and separated felt stigma, or this fear of discrimination, from enacted stigma, or the act of discrimination. And he said that to avoid enacted stigma, people who have stigmatizing conditions become experts at concealment, so that their encounters with overt acts of prejudice become rare. Rather, their lives become engulfed and disrupted by felt stigma. So in thinking about quality care for people who face stigmatizing conditions, including TB, we should not only address overt encounters, but also attend to some of these hidden manifestations of stigma, because they're critical to people's decisions about disclosure and about accessing social and medical support.
So my research project, I'm actually exploring the antibiotic prescription behavior amongst the general practitioners when patients present with TB-like symptoms. So my favorite theory is the theory of planned behavior by Azan, specifically the concept of perceived behavioral control, which speaks of access to resources. So when cash-paying patients present themselves in the private sector with common TB symptoms, they don't get diagnosed due to the financial constraints. And on the other hand, the general practitioners do not have the point of care test to test for TB and other infections, leading them to prescribe short-course antibiotics, which can lead to the diagnostic delays. If now the general practitioners could be given access to affordable testing, they'll be able to test for TB and other infections on site, limiting behavior of prescribing short-course antibiotics to potential TB patients.